What's up, Z-Pack? We're coming to you early today because we're in Houston, Tom and I, doing a talk for the National Athletic Trainers Association. We're really excited about spreading the word about 3.0. But when we heard that this Australian surgeon, Dr. Pritzwald Stegman, had died after 4 weeks in intensive care in Australia, and the reason he is dead is that a patient sucker punched him in the lobby of a hospital after he approached a patient about smoking inappropriately in an area where you're not supposed to smoke. This was a father, a husband, a colleague, a cardiac and thoracic surgeon, well-esteemed, and clearly one who cared about others and dedicated his life to serving others. And he's dead. Why? Because of violence against frontline healthcare workers in their place of work. This would never be acceptable in any other space. And yet, it seems as usual, everybody is brushing it under the rug. And, the worst part about this, and again, this was all caught on camera. So there's closed-circuit TV. You see the patient punching him. The whole thing is, and of course, the press has to call it alleged.
It's alleged.
It's alleged.
Even though it's on camera.
The alleged one-punch attack that killed this surgeon, right? It's all on camera. But I get how the press has to be. All of this happened 3 years after another surgeon, a neurosurgeon, and his name is Dr. Michael Wong in Australia, was stabbed by a delusional psychiatric patient in the lobby who was under the delusion that this neurosurgeon had botched a procedure. Stabbed multiple times, nearly died under nearly identical circumstances. And this doctor was interviewed a while ago before Dr. Stegman passed away and was basically saying nothing has happened. Nothing has gotten better to prevent these sort of attacks on healthcare practitioners. Now, we obviously have been talking about this for some weeks now after the nurse was attacked at Del Nor Hospital. Another nurse was viciously stabbed in Massachusetts. Another nurse was shot in Ocala, Florida. When is it going to stop? And here's the interesting thing. Like, I think a lot of people were like, well, when a nurse gets hit, nobody seems to care. When a doctor gets hit or killed, everybody is up in arms. That's not true. I see the same level of malaise about, well, you know what, these things happen. It's part of the job.
I like this, even their languaging here in the article. It says, a Melbourne surgeon who was almost fatally stabbed. Like, but he lived. Like, he's fine,
you know. And sure, it was a patient.
No, he got stabbed.
He was stabbed by his own patient in his place of work. Okay? If that doesn't absolutely terrify you.
We're going to turn off the air.
We're going to turn off the AC, which means in Houston we're going to last all 5 minutes before we're a sweaty pile of goo. If that doesn't just absolutely mortify you, right, about how the public and our own administrations and our government treat violence against healthcare workers, right, then nothing will scare you. Okay, and this is a cause that we've taken up. We've been talking about it. We have the hashtag silentnomore. We want you to hit share on this video. You guys have been really engaged in the article about this poor surgeon's death today, and it means a lot because together we can actually have a voice. Now, what Dr. Wong, who was stabbed in Australia, has recommended some things. He said there are things that we can actually do. Last year, he apparently raised concerns. He said there's no security and protection for staff at hospitals, and he questioned why hasn't it gotten better. And this is before the surgeon was stabbed. What's most tragic, and this is a quote from Dr. Wong, and what really, oh, by the way, this is an international issue, right? You can't say, oh, it's the American healthcare system, it's the, no, this is Australia, right? They have universal coverage, near universal coverage. I mean, so this being said, what Dr. Wong said is, what's most tragic and what cuts deep to me is the attack at Box Hill Hospital. That was the Dr. Stegman. Happened almost identical circumstances to what happened to me 3 years ago. It begs the question, what's been done to protect hospital staff 3 years on? And he says he's not calling for airport security, but he's saying basic measures like security guards in public areas, separate entrances for hospital staff. How many of you guys really want that?
Basically, courthouse security.
Yeah, kind of something like that. Like if we can enter through a separate entrance, right? That requires security passes. Like that's great. How many doctors and nurses need to be hurt, traumatized, disabled, even killed before something can be done about it now. And I'll be honest, like, again, like these events happened in public lobbies. The nurses that were attacked were deep in the bowels of the hospital. One was in a triage facility. So another recommendation that they were making are behavioral health triage spaces. But those are just to kind of find the threats that you really know about. It's this kind of thing, right, that you can't predict. So you have to design systems that actually make it very difficult for this kind of thing to happen. See, why not metal detectors at the doors, Rene Magnus? Now, a lot of ERs have those, but like at the front doors, you do wonder because these are now becoming dangerous places. Not just for healthcare workers, but for patients who are cared for in these facilities, right? There have been hospital shootings. I mean, this is a big deal. Let's see. The Victorian government said it was deeply concerned by the attack and would talk to health groups to design new safety measures in hospitals. Yeah, I hope so, right? Because the Australian Medical Association is supporting this. Other groups in Australia are supporting this. This is actually a role where organized medicine, people like the American Medical Association, the American Nurse Association, they could have a big voice in this, right?
The sad fact is that it seems to have been in the general visitor area, the front door area, and that raises a whole new set of issues, they say.
Right, from the article. Now, the guy who stabbed or who punched Dr. Stegman, Pritzwald Stegman, he was apparently has psychiatric issues, diagnosed with drug dependency. So one of the reasons they're giving for a rise in hospital and healthcare worker violence is an increase in alcohol and drug use and abuse. And I think intuitively a lot of us feel this. I think there's also issues with mental illness. There's also issues with a culture of acceptance of healthcare worker violence and lack of security. This is just part of the job. The administration likes to brush it under the rug because we're more worried with HCAP scores and patient satisfaction than we are with the safety of our frontline healthcare providers. So these kind of things, until we change that culture, nothing's going to change. Now, I'm actually optimistic that we can make a dent in this problem because it's not like you have this kind of considerable violence in courtrooms, right? It's very rare when that happens. So it's just like I say with EHRs. We would never ask lawyers to be their own court reporters. Why the hell do we ask doctors and nurses and frontline healthcare workers to be their own data entry clerks? Well, it's the same thing with this. We would never ask a court to be unsecured. Why should we let an ER or a hospital lobby or a place of healing be unsecured? It's going to cost money. It's going to take culture change. It's going to take training. Yes, but these are human lives we're talking about, right?
And part of the reason we want to talk about this today and have something actionable to talk about is because we don't want to increase burnout among providers because we feel like talking about it all the time could make some people depressed and,
I think that's a valid concern. Tom brought this up before the show. He's like, are we, by talking about this, are we just stoking the fires of burnout that we are all feeling on the front lines? And it's interesting because Tom is kind of a second-hand observer of this. His wife is in medicine as a nurse practitioner student. I'm in medicine. So he sees it kind of indirectly, almost in a more clear way sometimes than we see it when we're immersed in it because we learn to suck it up and just shut up and move on, right? Because that's our culture. But the truth is, does even talking about this make it worse? No, I would actually say by talking about it, we form an actionable movement around it. And we actually make our voices heard because like the hashtag said, we've been silent for so long about this. We've just dealt with it. And many people who message me about violence that's been incurred on them in healthcare settings, doctors, nurses, everybody. I've had physical therapists tell me they've been punched and bitten and slapped and the administration telling them, it's not the patient's fault. They're not in their right mind. If you would have handled it this way, things would have been better. It's like, ooh, that's victim blaming. That's not a good thing to do, people. So us standing up, having a voice, saying we're gonna share these stories. We're not gonna let them die. We're gonna honor Dr. Pritzwald Stegman's memory and the fact that he has children who don't have a father now. He has colleagues who don't have a colleague that they care about, and he has a wife without a husband because of a systemic failure. Like, we can blame the patient. He has psychiatric illness. He's addicted to drugs. All of that's fair and fine. But if we don't look at the system, we're not going to prevent this thing from happening again, especially when 3 years prior it happened to a surgeon and nobody learned anything, from that. So these things can't happen in vain, you guys. And
it says, always on the side of the patients. Ugh. That's Liz. I think you should always be on the side of the patients until they cross the line.
Yeah.
It's like if somebody is victimized they're a victim of sexual abuse, you feel terrible for that person until they become the attacker, the perpetrator of sexual abuse on someone else.
Yeah,
then we have to lock them up.
Well, and I think the idea that we're patient-centric means that we have to be caregiver-centric. Like, in order to take care of patients, we have to take care of each other. This is a central premise of Health 3.0. We take care of each other so we can take care of patients. The patient's at the center, but they are not the center. They are part of the web that allows us to take care of them. And we are an essential part of that web. And until administration and government and regulators understand our importance and role and central necessity to this, this will never get better. We will continue to be commoditized. We will continue to burn out. Our children will not go into this. And then there will be no one to take care of us when we are old as heck and in a nursing home. So this is our movement, people. Like, this is why we do what we do in general, is to, yes, we like to shotgun beers live at night in a Houston hotel, but the reason we do that is to blow off steam so we can have the serious conversations with you guys and you guys can spread the word. Now, let's see here. Susan Williams says, that's the truth. We're pretty central to a medical system. Right? It sounds so obvious when you say it, but it doesn't feel obvious, right? Jen West says, how sad that he died over a patient that punched him, and they're saying, oh, it's the patient's fault. No, that family should sue. If the patients can sue us for everything, why can't they sue for something that's out of line? So again, it's just, there's a lot of anger. There's a lot of, it's easy to start like saying, okay, who's to blame? Who should you sue? That kind of thing. What we got to really figure out is who's going to make this better? It's going to be us, frontline healthcare people, working with our administrators, working with government to come up with better processes, regulations, systems. That you're never going to eliminate violence as human behavior, and the fact that we have drug addicts and we have psychiatric patients and we have demented patients and we have angry families means we're in a charged emotional environment. But that means we should have more security,
right?
Even than a courtroom or an airport, don't you think?
Yeah.
I mean, it almost feels like now you don't want to turn it into
not that an airport. That's
yeah,
terrible.
an airport's pretty. Yeah, you kind of need that because we're flying out tomorrow, and I don't need to be shoe bombed, Tom Heineber, again.
We got to put things in place for that elephant reaction that a patient, family member, or patient is going to have when they feel like for whatever reason they're not being taken care of.
Yeah, and here's the thing: how many of us have been in situations where our anger gets control of us? I mean. Just the other day when I was doing that rant on our live about people who like come and complain about our videos but don't watch them, like I remember I flipped a switch where I said, I'm going to let myself rant at the top of my lungs and let all my anger out in one 30-second rant. And I did that, and afterwards I felt really good. Now, what if you can't control that? What if that's not a switch? If it switches automatically, and now you're a patient in a hospital, you feel overwhelmed, you have a lack of control, and you start escalating like that. This is part of the human spectrum of behavior and consciousness. How do we deal with that? You put systems in place that keep that patient from harming themselves or others. We don't have those systems right now. So the compassionate thing to do is not necessarily to point blame everywhere, but actually to do something about it.
I shouldn't ask you to tell this story live on air, but do you remember that story you told me one time about a woman tried to punch you? And you grabbed her hand and were like, "Oh yeah, this is not okay."
Yeah. It was the worst thing I ever did. I was a intern or a resident, and this woman patient, literally, I was listening to her heart, and she literally, I think she did punch me, and I reacted instinctively. I just grabbed her wrist and put it down like this, and started shouting profanities at her, and immediately I was like, what the heck did I just do? And I apologized, and I told my resident. I mean, it's a whole thing. But we are human beings, and when and as healthcare people, we're held to such a high standard that when we're attacked, we almost feel like we can't defend ourselves or fight back. And so we have to first recognize, who are we? We're animals with a little bit of evolution separating us from, sludge. Yeah. And then put systems and training compassionately into place to make it safe for as many of us animals as we can. So, yep, the patient is always right, according to management. I've been punched, slapped, bitten, scratched, too, also verbally threatened. It's always the healthcare worker's fault, says April Reeling.
Kristen says, why can't we point blame? He punched the doctor in the head. When will we hold people accountable? Well, we are pointing blame at...
No, the patient needs to be held accountable.
And and I think it should be a more severe law when you attack a healthcare worker. I don't think it should be a regular violent crime. I think it should be more severe in the punishment.
I've said on this show that if you attack a healthcare worker, you should just simply go to jail for a long time. Yeah. Like it should be like almost like a hate crime,
right?
Like the way it's treated.
Well, it's worse to punch a cop in our society, right? But it's not worse to punch a nurse or a doctor. Or
now to kind of talk about the police angle. police get hit and slapped and punched all the time, and often they let it go. So it's kind of a similar. Sometimes they get pretty knocked up as well, even though it is technically against the law. Just like it's technically against the law to hit a healthcare worker, but does anyone enforce it? Do the DAs prosecute it? Is there a culture among administration to support? Now, I've heard a lot of administrations, people have sent me messages. My administration supports us 100%. They have no tolerance policies. They have signs in the lobby. That is a dope administration because they are standing up to the bullshit entitlement that is being encouraged by many other administrations. Like, this is a hotel. Come get your Dilaudid and your sandwich. Be a guest, be our guest. We'll give you Dilaudid and get you some rest. This turkey sandwich is the most fresh.
Erica Williamson says, luckily in Texas, it is a felony now to assault emergency staff. That's why I love Texas, y'all. Texas. Okay. Texas is increasing death penalty, right? If somebody saw, like, if more than 3 people see you do what you did, you get to die faster in Texas. Because they're like, yeah, we saw you do that thing you did. Mm-hmm.
I'm not a fan of the death penalty. I'll just tell you why. I don't like the state. I don't like the state putting people to death.
Are you a fan
I'm a fan of vigilante death penalty. Like, okay, the family you get to go in the Hunger Games arena and murder your mother's murderer or your child's murderer. That to me is justice.
You like that Charles Manson's still alive? You think that makes us a compassionate society?
Yeah, because
we should have wiped him off the face of the earth a long time ago.
No, his victims should have been able to clown punch him. But instead, we use a merciless, faceless state that makes mistakes and kills innocent people. We need to allow the victims just to murder the perpetrators. That's my elephant. Now, my writer says, no, that's probably not okay, too. So please don't send me hate mail. But it does feel right. An eye for an eye, man. Hammurabi's code.
That's right.
Hammurabi was a hero to most, but he never meant shit to me.
You know the problem with the Hammurabi code is it was skewed. It wasn't actually an eye for an eye. So it was like an eye for an eye if you were 2 rich men. Oh. But if you...
But life for fruit.
If you wounded a peasant girl or something, there weren't the same consequences.
Yeah, that's true. So it was an eye for an eye if you're dope rich.
Yep.
Right. We just had a resident that threatened to punch a pregnant CNA just because she was trying to help her to the bathroom. Nothing's ever done or safe. Okay, listen to me, Rainey Johnson. Verbally threatening a healthcare worker, to me, is an actionable offense.
Yeah.
Like, that is similar to making a death threat or doing something like that. Like, it should be dealt with, and that would discourage it. Now, we had a show about are body cams helpful to deterring violence against healthcare professionals. Well, in this case, this was all on closed-circuit TV in Australia. In Australia, Dr. Pritzwald Stagman, it was all filmed. The guy, the patient probably didn't care because he had psychiatric illness and may or may not have been on drugs. But the idea that a practitioner wears a camera that they can turn on when they think something's escalating and it has a big bright red light and people realize they're on candid camera, could that actually de-escalate certain things? It might well.
Nicole said, we've had many patients and families threaten to come back with guns and, quote, unquote, blow us all away.
Yeah, I've heard that many times.
Yeah. And it's legal in our state to carry, so it's a scary time for healthcare staff.
Yeah, unless the healthcare staff get to carry. Then it's a scary time for everyone because everyone's got guns in a hospital. We're in Texas, though. That's apparently a cool thing to do. It's more severe with police officers. Should be the same thing. Kristen. Scroll down, see some comments here. Let me know where that administration exists, jail Simonville. So I've heard from quite a few frontline staff that they work in hospitals that really do support no tolerance policies on that. So they do exist, guys. And in fact, you know what? They're going to exist more when we encourage it. Here's another little thing, Tom. So in Health 3.0, entities are paid based on outcomes, but they're also paid on a mosaic of physician, nurse, frontline provider satisfaction and well-being, as well as patient experience, as well as actual outcomes. So when you mosaic that up, well, if the frontline staff feel unsafe or unsupported, that organization is going to get less money. So it's no longer going to be a Hilton. It's going to be a collaboration where, again, patients are at the center, but they're not the center. Everybody is part of the web that matters to make patients better. Are you calling someone?
No, just...
making sure the audio's okay?
Having issues with my first Facebook. But it doesn't seem everybody's having this issue. But some people are.
Well, seems like we're still broadcasting. So I think what we should do is Texas, here I come, says Jail Simonville. He likes to carry.
Texas
or Yael.
Dope.
Yael, sorry. Brett Oliver, loss of personal responsibility and no one pushing back culturally, Brett Oliver. Do you agree?
I do.
I agree. As a patient, I can't thank healthcare workers enough for their dedication. Thank you, Rebecca Esparza. Rebecca, thank you for appreciating what we try to do and being that rare patient that expresses love and gratitude our way. And we'll do our best not to let you down and to show compassion in the face of human suffering, which is in short supply in this world. Let's read some
Lori
more.
says we have separate entrances and metal detectors in the ED. Now, is this something that happens in low-income areas?
I've seen it. I've seen it in county hospitals more than I've seen it in upscale hospitals. You know, the Del Nor Hospital was an upscale, suburban, rich hospital, right? And yet this happened because of lax security. By the way, more information has come out on that case, the Del Nor case, from the press there.
Oh,
so,
really?
Guys, this is important. You think we don't have a voice. You think that we're powerless. Just by being here with us, you are giving yourself a voice and power. And here's an example. We kind of really hammered on that Del Nor case because I talked to the nurse who was the victim, and she gave me permission to share her story in a way that the press had gotten it completely wrong. The press itself now in Chicago is taking a good, long, hard look at how it reports. They reached out to me. I told them I'm not going to talk to them at the request of the nurse because she has her own processes in place for press. But the idea that now they're taking a good long look and they're writing about this from a sort of a meta-analysis. What did we do right and wrong? And it's interesting. So more information is coming out about the correctional officer who fled and abandoned this nurse and basically his duty. And it turns out there were some, and this is still preliminary and I may be getting this wrong, so I apologize. I read this in a piece done by a Chicago Sun reporter on a blog, that he was actually really not happy in his job, felt overwhelmed, was a little bit scared in general, and that there was a lot of pressure that maybe he should have been fired, but firing people in that union environment is very, very difficult. And so we have now the wrong person in the wrong place with the wrong patient who was known, had a reputation for being crazy. And that's not mentally ill. That's just freaking crazy. Like nuts, and in a violent offender way, right? And so you have all the situation that we should have seen coming, and it was a failure, a systemic failure in multiple points. If you did a root cause analysis on this, Tom, because I know you love root cause analysis, and I know we all do, because we sit through those damn meetings where they blame, well, if Betty had just turned off the beeping IV, then everything would have been okay. So if we'd done a root cause analysis on this, we would have found multiple system failures in that setting, right? So this is how we have to look at it systemically. We have to look at it compassionately. We have to look at it using our science hats, but also our humanistic hats. So it's a felony to assault medical staff in Missouri, says Elizabeth Eileen, but does it matter if no one prosecutes it?
No,
and it's only a felony if in the ER in Texas, it's still a misdemeanor on all other floors. Is that ridiculous? If that's true, says Tammy Hamill. Z has a Hell's Angel mentality. Do I?
You do.
I just go vigilante on everyone?
Yeah.
Yeah, I kind of like vigilante justice, even though it's wrong on every ethical, moral, and scientific level. It makes my elephant happy. Like when I see Rambo shooting up a bunch of people who wronged him, I feel so good.
Remember when the Hells Angels stabbed that dude at Altamont?
Oh, yeah. Right. Or when I see Neo at the end of The Matrix, and he just single-handedly destroys those agents. It is one of the most uplifting feelings of elevation that you can get because it's justice. I don't know. So let's see.
Melissa says, I live, work in the Chicagoland area, and the only place I've been hearing about the Del Nor report is here.
That's so
on
effed
this
up.
show.
So effed up. Like, come on, guys.
They're not talking about it at all. Very sad.
And you think we're going to let it die? Heck no. Like, we're going to keep pounding on this. We're going to sound like broken records. My elephant likes your vigilante elephant, Rachel Casper. And I like you, Rachel. My rider and my elephant likes you. Florida needs to get with these states. Yeah, man. You can't believe in an eye for an eye and not believe in the death penalty. Kristen. I actually don't believe in an eye for an eye. My elephant believes in an eye for eye. But my rational side says that's not really how justice is done. It has to be a little more complex than that because actually I don't really believe in free will. I don't believe people are the author of their actions. And we'll talk about that another time. So you're kind of doing something, you're allowing the state to execute human beings. Now, if you convince me that it was pragmatic for the state to do that, in other words, someone's guilty beyond a shadow of a doubt and killing them saves the state this much money, I might actually be more swayed because it rationally makes sense, but it actually is more expensive to put somebody on death row
Here's the problem with the death penalty. A lot of people don't think about. You're actually inflicting harm on the executioner, the person who has to kill the person.
That's also true. Unless
when you could just put this guy in, like Charles Manson should be in Supermax,
Right.
in a little dark room with no windows,
Yeah.
and we should never hear or see from him
Right.
ever again. No parole, no nothing.
Yeah.
Just gone.
Yeah,
from
it's just
society.
done. And, you know, and that's simply a pragmatic response to the danger that Charles Manson poses to society. So, and again, we're getting a little esoteric here, but the idea that you would then get him out of harm's way, meaning out of the rest of society, whether you believe that he was he's just a misprogrammed robot, right? Which is partially what I believe about free will. We recognize our actions, but we're not necessarily the author of them because they bubble up from conditioned, pre-existing neurologic conditions. So I'm a kind of a determinist that way, philosophically. We'll talk about it another time. But so say you even believe that, well, does that stop you from societally killing bad people on the scene of a crime? No. I think people who walk into your house with the intent to rob or hurt you should be murdered instantly at the scene by you, if you can get away with it. But do you allow the state to do that in controlled environments? Is it better just to lock them up forever? And what is there a deterrent effect to the death penalty? I'm not sure a psychopath is deterred by the death penalty.
Julianne wants to know what you mean by no free will. So this is going to get into a deep rabbit
That's another
hole.
discussion. So if you go and search
Z
one of
doesn't
my
believe in free will.
go and search my Z vlog that says free will. I forget what it's called. It's just like called free will. So just search ZDogMD free will. You'll see a talk I did about that that's based on a book by Sam Harris by the same name, Free Will. We'll do a whole show on it, and we'll argue whether free will exists or not. And I hope to convince you that it doesn't, and allow that conviction, not to allow you to forgive people's decisions and allow chaos in the streets, but to be more compassionate and understanding, and to understand that how we design the path that the elephant and the rider walk on is important to encourage the right behavior in human beings.
Jen says, since the Delnor incident, my ED hospital has made many improvements in our security and practices in dealing with patients and families who act out against staff. Our administration has said they back us up when we are assaulted and encourage us to press charges, and they are working with local law enforcement to allow for better practices in dealing with issues we have and need to call them for, as well as patients they bring us who are in custody. We have a long way to go, but it is great to feel supported in this issue. And I think, there are a lot of administrators out there that get it. And listen, when we talk shit on administrators, we're only talking about bad administrators who don't get it, who are stuck in the past.
Yeah.
Right?
Yeah.
We're not talking about the guys that are on our team, the girls that are on our team.
They are 3.0. They're part of our
things.
tribe. They're welcome in this tribe. They're encouraged in this tribe. We need you in this tribe. And I get messages from administrators it's amazing, Tom, like their feelings are hurt because what they do that is good is not recognized. And I think there's such an adversarial relationship between frontline staff and administrators. And we tend to encourage that sometimes through our jokes because we are the voice of the frontline staff, but we're also the voice of the administrators who are trying to do the right thing, who are trying to build 3.0. And when I go and speak, I meet these people, and they are heroes in and of their own right, and we support everything they do, and we need your voice. So join us.
Matt Phillips says, my partners kept guns in their offices against rules, but...
Yeah. Well, I mean, I'll tell you, like Logan Stewart is constantly carrying a weapon.
Yeah.
And so if you want to come to our studio audience and hang out with us, you got to understand that Logan is always packing. So if you want to do us harm, it's going to be a duel to the death. And probably Logan will win because I've seen videos of him shooting weapons. I'm terrified of guns myself. I went to a shooting range and I fired a bunch of guns, and I thought it was the greatest feeling I've ever had, but I'm just not, it's not something I want near me because I feel like accidents happen more than that gun's going to help me. So that's just my elephant. I don't want them around my kids. It's just, that's not who I am. But I do respect people who believe that that's something they want to have around them, and they want to know how to use safely, and they want the right to carry that. So I do support that. All right, in pushing 3.0, are you also going to fight to make the military healthcare system fall under this as well? Chris Willoughby. Well, why shouldn't they be part of this? Everybody from the VA up to military healthcare, it's a very different system, but in many ways suffers from the same problems. Some of them are actually more acute. So yes, absolutely, Chris. And in fact, we have a lot of connections in the military. We will be getting the guys from Nellis actually are talking to us about coming on the show and talking about military medicine, and it's going to be an amazing episode. And now that we have a studio, we can actually have guests. We just got the set. We're trying to set it up, so stay tuned. It's going to be awesome.
What's the deal with the elephant, just to end on? John wants to know.
We're going to do a book report on this again.
I saw a couple others asking.
Yeah, let me just summarize that again for people. I summarize it every third show or so. There's a book called The Happiness Hypothesis and a second book called The Righteous Mind by a guy named John Haidt, H-A-I-D-T. He's a psychology professor. he has this metaphor that the human mind is a mind divided. It is divided into this big elephant that's ancient and highly evolved over millions of years.
AKA the limbic system.
The limbic system, the paleocortex, the old parts of the brain that are emotional engines. So hope, fear, religion, belief, politics, threat detection, unconscious decision making. That's 99% of how we behave. We made a decision before we even know we've made it. And so how our elephant is conditioned through a combination of how we're born, genetics, how we're raised, conditioning, and the exposure of the environment determine how we're going to behave. And that's why I also say free will is a bit of an illusion. Now, you can have free won't, where you recognize something bubbling up and decide not to act on it. But even that is a level of abstraction. But the bottom line is that elephant makes our decisions. The writer is the little guy on top. He's our neocortex, barely evolved out of the soup recently. And we think he's in charge. We think reason trumps passion. It does not. It's the other way around. The writer is our press secretary. He's there to explain to other members of our tribe why why our elephant is behaving the way it is.
Yeah.
So look, if my elephant doesn't like the death penalty because it's scared about the government inflicting death on citizens, then my writer will be like, okay, well, the death penalty is too expensive and it doesn't deter crime. That's how the writer will explain my innate uncomfort. It'll just be like, I've already made the decision. I don't like the death penalty. My writer will say, well, this is why. And those reasons are often post hoc. They're just to justify an intuition that you have. So when we respect that we have each other's elephants, we can talk to each other's elephants with respect and understand that you're not going to change that conditioning unless you, first of all, speak from a place of respect and talk to the elephant's hopes, dreams, and fears, not just try to spin facts and reasoning and arguments. They will often fail. You will never convince people that way. So our whole movement is based on this idea of elephant and rider, talking to other elephants and motivating the elephant while respecting the rider. All right. I think we've wrapped this shit up. Hit share, use the hashtag, make this a movement. We won't stay quiet about this, Z-Pack, and we out.